your body, what it might be telling you, and run tests. Well, Agogo and I will be speaking to Bisi Bright, who is a public health practitioner, and Kehinde Olatona, who is a health service officer. Wonderful to have you in the studio this morning.
Thank you.
All right, it's a pleasure to have you guys in the studio this morning. So tell us exactly what you have in store.
Yes, we're planning to have to host what we call the Grand Health Bazaar with effect from tomorrow. So it's a 3-day event, and we're focusing on local content industry tomorrow. And then on Thursday we are focusing on agriculture, and on Friday we are focusing on food and beverages. But everything is centered on the fulcrum of health. So we're looking at health as a common denominator across every sector in the economy. And so we're calling it the Grand Health Bazaar because it's a multi-sectoral corporate event that brings together the different sectors of the economy, and the corporates will be coming together to trade. So there'll be a lot of trade and commerce, but it's a 3-in-1 event. So we're going to have a health fair, and then plenaries, and a big exposition.
Okay. Now, let's talk about the fact that it's going to be a health fair.
Yes.
Now, the first day you are concentrating on local content. Are we talking about local drugs? What are we talking about?
No, we're looking at the local content industry generally in the country. So
Just
we're going
beyond
yes,
health.
we're going beyond health to look at, for example, the oil and gas sector will feature, the cassava initiative will feature, you know, the conversion from wheat to cassava, which is local content. So we're looking at sourcing for things locally. And the reason why we've gone into that area is that we believe that contemporary things that are happening in the country and are in the conscious awareness of the people, let's bring people together to talk about them. But at the end of the day, we're relating it to health care. So for the local content sector, we're looking at the ecosystem and how healthy the ecosystem remains, even after you've converted from some other source to a more local source.
Oh,
yes.
Excellent idea.
So what gains are there to the ecosystem? Then on Food and Beverages Day, we're looking at food as medicine. So it still has a health undertone. And people don't really realize that what they eat really makes up what their health would be. And then, so that will be taught to the people. And then on Agricultural Day, we're looking at biodiversity, you know, things like organic foods, non-organic foods, etc., etc., and the health implications.
Okay, now let's talk about organic foods. Before I come to you, Kehinde, let's talk. You're a health service officer. What do people need to know about organic foods and non-organic foods? Because I mean, there's always this thing that in Nigeria we grow a healthier food. We grow healthier food in Nigeria as compared to countries where it's different. They use preservatives and all of that.
Yes. Well, the organic foods are definitely much safer. That's why they become more expensive, because the inorganic foods, those ones are treated, either chemically treated or, you know, grown with fertilizers and other things. And so when you talk of safety, those ones contain chemicals that could lead to disease and toxicity.
So why do we use them?
You want your tomatoes to be bigger, you want, you know, you want a higher yield, and so you go into the use of fertilizers and so on. But at the end of the day, there is a lot of toxicity associated with these things. So it has to be balanced out. That's the truth. And that's why we are bringing in experts. I'm not an expert in that area really, but we're bringing in experts to talk about, to look at it on Agricultural Day and talk more about it, and possibly end up advising government. You know, the outcomes of that conference, for example, may help in policy formulation.
Okay.
Yes.
All right. Kehinde, you are you're a health service officer. Now, in your work with the Nigerian people, what has come to your notice? Are we very conscious? I mean,
I noticed that Nigerians they didn't really take care of their health, especially people working in the banking sector, even oil companies. they will just, most of them will just be working, but at the end of the day, they won't know that even there is something affecting them inside, but they didn't really take care of their health. So this program we are using this medium to invite people from various industries, banking sector, oil and gas, and even students.
And even broadcasters. Highly networking, and
businessmen and women to come to this program, just to know how to deal with their health, to manage stress, to manage fatigue, and also to take care of themselves.
I hear there will be free health checks.
Free health?
Health checks. There will be health checks?
Yes.
Okay, let's talk about health and age. Now, I'm young, but obviously there are certain things. Agogo is somewhat young.
You are very young.
I'm young, but he's somewhat young. He's not so young. So, I mean, what should we be looking at different stages of life? What kind of medical tests should we be taking? How should we be taking care of our bodies?
Okay, thank you. We've already made arrangement has been made for different. For example, we have our trained officers they are at last even to attend to people that have HIV, diabetes, different diseases. So the experts are ready, and the equipment are also ready just to take care of them for the program, the 3-day events.
Okay. Well, let me direct that question to you. How do we propose we take care of ourselves? I mean, you see a person in their 20s. Now, let me even say the heart attacks are more rampant these days, even with younger people. So, I mean, how do we take care of our bodies through the 20s phase, the 30s phase, the 40s phase, and even the 50s and beyond? What checks do we have to do? How do we have to eat and all of that?
Well, you're right. Of course, the older a person gets, the more prone to disease. That's why there are things you call the old age disease and so on. But the truth is that right from any age at all, each person should watch what they eat, what they drink. You know, if I decided to make my regular drink alcohol, then I'm headed in a particular direction because I know that my liver would not like that. So really, at any age at all, each person should take responsibility for their health by watching what they eat, what they drink, how they think,
how they think.
Yes, how your thoughts, your emotions. You know, the World Health Organization has defined health not merely as the absence of disease, but a complete state of physical, psychological, social, emotional health and well-being, and not merely the absence of disease. So many people don't even know that. So the way I think would affect my health, the state of my health. So at every age we should look at that. And then as we progress in age, there are certain landmarks, like for us women. For women from age 30, you should take calcium supplements. It's like investing in old age, so that when the bones begin to want to get porous at older ages, you've already invested in healthier bones by taking calcium and calcium-rich diets and so on. So those are some of course, responsible sexual behavior and a lot of things which people don't really consciously think about, but which cumulatively add up to their health later in life as they move on. So at every stage in life, we must take full responsibility for our health, and we must take responsibility for preserving our bodies, because as one gets older, the body starts to give way. And a friend of mine was just saying the other day that anyone past age 40, work in progress, that's maintenance. There's some maintenance work going on all the time, you know. But if a person is careless and doesn't think of that, takes a lot of alcohol, plenty of salt, is highly stressed and is not managing.
How do we even manage the salt problem? Because salt makes the food sweeter.
Yes, it's a very good condiment and flavor, but too much salt would lead to hypertension, even in people that were not normally prone to hypertension. So it's now a question of balancing between the taste buds and the heart. So what's good for the taste bud may not be good for the heart. So if I like fatty foods, I like the let me speak a bit of vernacular, unshora taste. It may not necessarily be good for my heart, you know. So we need to balance it, and that means we need to take responsibility. Each of us needs to take responsibility, and we need to listen when we find signals in our body. We listen within and do something about it. And of course, run medical screenings from time to time. For example, you talked about the age thing. By the time a woman is 40, she should have done at least one pap smear to check her cervix, at least one by age 40. And for the men, from about age 45, a man should at least have one prostate screening, you know, and so on and so forth.
Okay, let's talk about public health in Nigeria. We see the way things are going, and a lot of people are dissatisfied with what they are getting. Is it a problem of funding, or the practitioners not available or not properly trained?
I believe that the healthcare practitioners in Nigeria are very well trained. We have a very good resource of very well trained healthcare practitioners, but I think there is a dearth of sufficient equipment, and then the population is very large, and that really affects access, you know, because healthcare is a very expensive commodity. So if you're talking of access for about 160 million people, you now need to balance between quality and access, and that's why there is health insurance and a lot of other health initiatives. Like what we are doing in the next 3 days is to make healthcare accessible to people who would either not want to procure or do not even have the time, because sometimes for the executives it's not even a question of not having the financial means, but they don't have the time, and they don't search for healthcare until they're in trouble. So a forum like this would bring healthcare to the doorsteps of the executive, of the elites, and of the lettered people, and they're going to have a free screening, and you find people who've not screened themselves for maybe 6-8 years, and then they're able to walk in and do all of that while they're still doing their trade and commerce and jaw-jawing about intellectual matters. So it's a question of bringing in a lot of innovation into the health system by making sure that health is taken to the people in a way that it's easy for them to procure, not necessarily with cash, but with time, because this is now giving them health care with time. They're procuring it with the time, so that time can be managed in procuring health and still running business at the same time. It's not necessarily the financial lack of means that really causes people to have poor health. For the elites, sometimes it's a lack of time. They don't have the time, they keep postponing. You hear people say things like, I go for my screenings twice a year, my doctor is in Germany, and I'm good to go. But what if something happens in between? What then do you do? So those are what the things we're talking about.
I've seen a number of screenings, and the crowds have gathered, so oftentimes no matter of really whether we're having the screenings or not, because you'll have crowds in community centers, town halls, and all of that. In your recommendation, when you're going to submit to the government what you will do, are you going to be thinking of how you can make this sort of screenings readily available to the public? Is this something you'll be looking at?
Oh yes, this is what we do already. We run a lot of screenings for the public. We run public health fairs. But what we're doing this time is for the elites. We have the public health fair for the masses. We do those in the markets, in the parks, and so on. And you really see people coming in to queue up and to avail themselves of free health. But you would hardly find a banker queuing up in public to procure free health, because he or she already has health insurance. But how well do they use those facilities? Because optimal use is very important. You find out with health insurance is either overused or underused. If it's underutilized, then that person needs health care and is not going for it. then the condition worsens before the person procures healthcare. That is bad. And then if there is overuse by people of lower means, which is also too much pressure on the system. So we try to fill in those gaps by running programs like this, and the programs are designed to meet the needs of the various population groups. So this, for example, is a middle to high income program. It's a formal event. The dress code is formal. We want people to come formally dressed. We believe that in filling these gaps, we will be able to make a mark and have some palpable impact in the health of the people.
Okay. All right, now we're talking about the 3-day event, the Grand Health Bazaar, local content. Let's go back to local content, local content and health. I'm very curious as to why you have the local content on this one.
Yes, we picked local content because we look at contemporary issues in the nation. For example, last year we looked at the aviation sector, we looked at the real estate sector because buildings were collapsing. You see that we're not really having so much of that anymore. We brought people in the real estate sector to come together and talk about that, you know. And then, so this year we're looking at local content because the government is putting a lot of focus on that. You know, the government now has a sugar policy. They have the ethanol policy, etc., the cassava policy, and so on. And we feel that people should really come together and talk about these things. These are policies that would make health more impactful, improve on the health of the people, reduce the cost of producing those other alternatives that we were using before, and improve employment for Nigerians, employability, and all these things add up to health. So that's why we picked local content. We felt that if we build up the local content in everything we're doing in this country, we will be truly emancipated as a nation.
Okay. So the Grand Health Bazaar will be having local content. Agriculture and food and beverages will be a 3-day event. When and where is it happening? What time is it starting?
Yes. It's taking place at Havila Center, just down the road to Sheraton 4 Points in Victoria Island, at Oniru Road. And it's from 10 a.m. to 5 p.m. daily from tomorrow. Okay. And it's free of charge, but it's formal. It's free but formal. And we're going to give certificates of attendance to everybody because it's a free training. It's a free 3-day training. So daily there will be free certificates of attendance. And of course a free health fair where people can run so many screenings. Like he mentioned, we're going to screen for hepatitis B and C. We're going to screen the normal voluntary counseling and testing for HIV/AIDS. And then even things like prostate cancer screening, etc., etc. Prostate for the men. We would look at doing breast cancer screening for the women. But we won't do the cervical cancer screening tomorrow because that needs a lot more of privacy and all that. We will have a private area for breast cancer screening, but we will not do the cervical tomorrow. But we will be screening for basic things like malaria, and of course what we call the basic biometric screenings, blood pressure, sugar, cholesterol, and so on, body mass index. Many people don't even know these things, and they don't know the health implications of obesity and so on.
Okay. I want to thank you for coming on the show this morning.